with Dr. Hess is we're celebrating an important step forward. We're hiring over 900 new nurses that will be working in a variety of settings, but one of those settings is here in homes of people like Dr. Hess. We're hiring rapid response nurses because we know that for some people, as they leave the hospital and get settled again at home, there can be a gap in service, that they might not get the medication they need, they might not get attached to the supports they need. So of these 929 new nurses we're adding, some of them will be working with people just like Dr. Hess to come into the home within 24 hours of discharge from hospital and making sure that the patients have the support they need. I'm delighted to be here today with Dr. Mark Nowaczynski and others who really have demonstrated that we can provide better care for people in their own home and keep them out of hospital and keep them out of long-term care. As you heard Dr. Hess say, this is where he wants to be. This is home, and I think all of us would like to be home if at all possible. So we think it's up to government to do whatever we can to support people to be where they want to be. Now, you know that we are embarking in a transformation in healthcare in Ontario, and a big part of that is providing care for people outside of the institutions of hospital and long-term care, providing care for people in their own home. It means we have to do things a little bit differently. So in this budget, we made a decision that our biggest priority was investing in home care and community care. And if we were going to do that, we had to hold the line on some other things. So we're holding the line on hospitals. They're getting just a 0% base increase. We're giving a 0% increase to what we spend on physicians. But we're doing that because we really see great opportunity to do better for people in their own homes. So you can only spend a dollar once, and I'm absolutely determined to spend money where it's going to make the biggest difference for people like Dr. Hess. Thank you. Happy to answer any questions.
How much is this investment going to cost?
So I'll get you the exact number, but it's about $80 million a year that we're spending on over 900 new nurses, and including nurse practitioners. It's a range. We'll provide you with the list of new nurses, what they're doing. Some of them are mental health nurses working in schools. Some of them are nurse practitioners working in nurse practitioner-led clinics, primary care clinics. Some of them are nurses working as outreach into long-term care to prevent people from having to go to the emergency department. So the nurse outreach teams actually go to where the people are rather than having the people come into the hospital. So a variety of different venues where these over 900 new nurses are going to work.
Great. Orange.
Orange.
The color orange, your favorite color, right? We had the shortage yesterday. Have you found out exactly what happened? And I know you released a statement. We haven't got that on tape yet.
So this is a terrible tragedy, and I have asked Dr. Barry McClellan, the CEO of Sunnybrook Hospital, and a board member at Orange, to ensure that an appropriate review of this incident is underway and is happening. We need to get all the facts. My ministry officials have asked a number of questions of Orange, so we understand the facts behind this. So I can tell you that we are determined to understand what happened, and if there are changes we need to make as a result of the learnings from this, then we will look very, very closely at that.
But Orange has released a statement saying that they had one shift that was out on one crew was out at a call, on the way route to call, and the other crew had exceeded their federal guidelines.
That's
and
right.
They were, and the critics are suggesting that that's the problem with chronic shortage in staff. What have you done to address that problem?
So I can tell you that the staffing issues, whether it's pilots or paramedics, is a very high priority for the new board and the new management team at Orange. So they've been there for about 4 months, and they are making some important changes and improvements. So I think what's important is that we understand the facts before we jump to conclusions about what the solutions are. And so I need to let that work happen before we start talking about what the solutions are. I can tell you, though, that as part of the new performance agreement that we put in place with ORNGE, ORNGE will now be reporting on the calls that they have declined. So we will be able to know what calls were declined, how many, and why they were declined. I think having that information is going to be very important as we continue to improve the quality of care at ORNGE.
And I understand that, but I just, was there a staff shortage? Is it a staff shortage of pilots or paramedics? Is at ORNGE right now, and they're trying to replenish, or how? So
I do know that that ORNGE is looking to hire new pilots. I do know that. I do know that there is a global shortage of pilots who are trained to fly these particular aircraft, and ORNGE is dealing with that. It is a priority for sure. I also know that they're looking on the side of paramedics to improve the training, to increase the skills of the paramedics who are working to make sure we have all of our aircraft able to respond when necessary. It's important to know that there are two helicopters out of the island. One of those helicopters was on a call to another call, and so they were busy. And sometimes in emergency services, there are decisions that have to be made, and so on the staffing issue, I don't want to make any judgment until I have the facts.
When do you think you'll have the facts and know?
I don't think it should be too long. I don't have a timeline, but I don't think it should be too long.
Okay, and I haven't talked to Zita about this, but postpartum depression and the work that CAMH has done and all that stuff. Are you comfortable answering that? Do you want to check your facts?
I'd rather get some more information.
We can arrange for something this afternoon.
Is that now, or if the guy can wait, or whatever?
We can wait, and then can I chat with you this afternoon? Okay.
Yeah, it'd be unfair to ask you a question now, but
thank you. I appreciate
that.
Let's. What about home care? Aren't you interested? Aren't you interested in the care of our frail seniors and providing compassionate and humane care here on the ground?
Oh, I understand. We've done that, sorry, and we've done features on that story, yeah. But I have producers then.
Those producers. He wants to know about this, but his producers.
Yeah,
I don't know.
Minister, just given the fact that in these days everyone is tightening their belt, does it really make sense for government to be sort of allotting resources in this way as opposed to, let's say, having more patients per healthcare worker? You know, this is sort of a one-on-one kind of thing. Do you know what I mean?
So this is one of those great situations where it's better patient care and it's better value for money. Because we know that when someone's in a hospital bed, it's far more expensive than providing supports at home. So this is part of that important transformation that meets both of our objectives, which is better patient care and better value for money.
And can you explain to me how it's more economically efficient to have one-on-one care versus in the hospital bed?
Sure. In a hospital, hospital-based care would be close to $1,000 a day to care for someone in a hospital. Long-term care, significantly less than that, but home care is far less expensive. So we know that the more we can support people in their own home, with the help of neighbors, friends, and family members, we can provide higher quality of care, a much better environment for people, and it costs the system less.
Great. Thank you, Minister.
Thank you.